So guys, let's take up applied physiology, and the first applied physiology is going to be drugs that interferes with platelet activation. People, there are few drugs. Number one, it is going to be aspirin, a very commonly used drug. You might have some elders in your households, your grandparents or your very senior elders in your household. People may experience certain kinds of cardiovascular disorders. All right, some of your known people, your family friends or very senior elders might have had an experience of simple myocardial ischemia, or they might have had a previous episodes of stroke or something. Those patients who had a hypercoagulable state previously and that lead to blockade of blood vessel or any other mechanism that led to blockade of blood vessel will be put on a commonly prescribed drug called as aspirin, which is something every doctor should be very familiar with, guys. So learn aspirin now itself and let your knowledge of aspirin keeps progressing as you move on into your subsequent years. But when it comes to this drug aspirin, guys, aspirin do have a tendency to block thromboxane A2. Alright, aspirin inhibits an enzyme and this enzyme is called as cyclooxygenase. Now basically cyclooxygenase is an enzyme that converts arachidonic acid. Arachidonic acid gets converted to thromboxane A2. Alright, arachidonic acid gets converted to thromboxane A2 and this event is mediated by the enzyme cyclooxygenase. Exactly, that cyclooxygenase is getting blocked by aspirin. So when thromboxane A2 is being blocked, what's going to happen, guys? Without thromboxane A2, there is not going to be any sufficient activation of platelets. If platelets are not going to get activated, this will lead to no aggregation and that will not lead to any thrombus formation. So the blood will keep flowing in the liquid state. There is not going to be any kind of platelet plug formation, guys. Alright, so that's exactly how aspirin acts as an antithrombotic agent. The same kind of mechanism but in a slightly different manner is utilized by other drugs, and that's going to be clopidogrel. Few related drugs like prasugrel, ticagrelor, as well as ticlopidin. People, let me give you 4 or 5 drugs so that even if you forget 1 or 2, that's going to be okay. Alright, so some of you might able to remember clopidogrel, prasugrel, some of you might able to remember ticagrelor, ticlopidin, that's alright. But you must be able to write at least 2 or 3 drugs when it comes to the drugs that influences platelet activation pathway. So clopidogrel, prasugrel, ticagrelor, ticlopidin, they go and selectively blocks. They block P2Y12 receptor. When P2Y12 receptor gets blocked, there is again not going to be any kind of platelet activation. So without platelet activation, there is going to be no aggregation, guys. And that's exactly these drugs act as antithrombotic drugs. So collectively, aspirin, clopidogrel, prasugrel, ticagrelor, ticlopidin, all these drugs are called as antithrombotic drugs. Antithrombotic drugs, guys. And please do not call this as anticoagulants. That's a very wrong way of calling antithrombotic drugs. Alright, you should never use the word anticoagulant when it comes to aspirin, clopidogrel, prasugrel, ticagrelor and ticlopidin. Alright, please remember they do not interfere with clotting mechanism, they interfere with thrombus formation. Alright, so that's very important point. Remember, it's going to be the second step, platelet activation. You got to write the steps in activation, you got to draw the diagram, also you got to go for the applied physiology, people.